Hello, and welcome to Celebrity Health Talk with Fatmata Karoma. In this show, I interview significant people in the community. These people come from diverse backgrounds and from all walks of life. My guest tells us about their healthy living secrets and healthy living tips. Be on the lookout for Celebrity Health Talk interviews in your city. On today's show, I am interviewing Ambassador Bokari Stevens of the Sierra Leone Embassy to the U.S. in Washington, D.C. So please relax and enjoy watching this show. Hello everyone, this is Fatmata Karoma of Celebrity Health Talk. I'm here at the Sierra Leone Embassy located in Washington, D.C. I'm here with Ambassador Bokari K. Stevens, who is Ambassador and Chief of Missions of the Embassy of the Republic of Sierra Leone. Good afternoon, Ambassador.
Good afternoon, Josephine.
How are you today?
Well, it's fine, and thanks for calling at the embassy.
Thank you. Thank you for having this interview with us. Okay, we're here today, and we basically want to know, what is your role as Ambassador of Sierra Leone?
As Ambassador of Sierra Leone to the United States of America, I'm here to represent my country, represent my president, and also as the chief political figure at the embassy. The embassy is here as a liaison between the government of the United States of America and the government of Sierra Leone. So you can see it's a huge responsibility that I carry.
And thank you, you're doing an excellent job. We want to know, why don't you tell a little bit about your history and what inspired you to be ambassador?
Well, I'm a young man from a very small village in Sierra Leone, and as a countryman, I don't think I ever dreamt of being an ambassador to the number one country in the world. Suffice it to say that in my own case, I never grew up determining to be an ambassador. I grew up wanted to get a fine education and be able to live a normal life and take care of my family and my extended family and things like that. And I have served as ambassador to Guinea, as an ambassador to United States of America. In all of those cases, I am a political appointee, which means I am not in the mainstream civil service. So perhaps that question could be answered more by my president as to why he decided to appoint me. But I served my party, my country, and I believe it's the president must have seen something in me that he thought I'll be able to make a fitting representation for Sierra Leone.
Okay, thank you very much. Does the embassy have any programs concerning healthcare or have any healthcare initiatives here in the U.S., maybe working with Sierra Leone government also?
The embassy of itself has no unique program. What we have is that we have designated officials within the embassy structure who deal with various issues: trade, investment, tourism, health. I designate most of these important issues to specific officers so that these officers liaise with the United States authorities, or where appropriate with the Bretton Woods institutions, the World Bank and the IMF, the Millennium Challenge Corporation, the Health Department. So they liaise with them to discuss issues of national importance to us. As ambassadors, we are all here, or as diplomatic missions, is to be able to get as much as we can get for our country, Sierra Leone. And that's what we do. And the health sector is one of the most important sectors that the government has in Sierra Leone.
Okay, thank you. What are your future goals? I mean, as ambassador, with the embassy, I know elections are coming up, and there are going to be lots of changes. So, what are your future goals, and what are the future goals of the embassy?
I think the embassy has come a long way from independence up to the time I came. I believe even its physical state itself, I believe we've made a lot of improvement there, and we've made Sierra Leoneans to know that the embassy is here to serve them. I believe many Sierra Leoneans now make use of the embassy, And we have our website, and we try to encourage Sierra Leoneans to see that this embassy is theirs to use. As for the future, one will want to see more cooperation between the embassy and its Sierra Leonean nationals, but more so we need, I would say funding is a constraint.
Okay.
Because there are many things which the embassy might want to do, but because of the difficult situation it finds itself, we have to limit it to what we are doing now. Because the truth is, representing your country is a very expensive job. I mean, you have to meet with congressmen, you have to meet with heads of corporations, you have to meet with heads of chief executive officers, and inviting these people for lunch or even taking them to your house, because these are the ways you take to serve your country. Yeah. It involves money. So what I think this embassy will do is to be very proactive, and one of the main areas we are thinking of is using our Sierra Leonean brothers and sisters, the DNA Sierra Leoneans, the Gula connection that we have with South Carolina, the direct connections which the Sierra Leone has with United States Black Americans. We think we can use this very much to the advantage of both countries, and that is what I want to see develop in the next couple of years.
Thank you. I also wanted to know, you know, this is a health show, and I would like to know, what do you do personally, to maintain your health? It could be in the form of stress management, it could be in the form of fitness, healthy eating. Just what do you do to maintain a stable, healthy life?
Well, despite being very busy, I try to, back home I eat a lot of cassava leaf.
Okay.
But here I try to minimize that, because it's a sedentary job. You are sitting most of the time, so one has to balance yourself. But I mean, the impact of information technology keeps you on your toes.
Okay.
I mean, anytime you open the radio, there's talk about diabetes, talk about obesity, and so whether you want it or not, you are forced to listen.
Yes.
And if you listen, you have to follow up. Like this morning, I think I did an hour exercise. I have a park close to me. Okay. Every opportunity I get, I try to do it. Oh. So and eat sensibly. Yes. I'm not saying I'm perfect, but this is something I try to do. It's difficult for a busy schedule to be able to fuse it into regular exercises, but I try to do as much as I can. Okay. I'm 62 years of age, so okay. I feel myself very good.
Anything you enjoy doing in form of relaxation or stress management? I know you have a very busy job, and you definitely need to have a downtime or find forms of activities to relax.
The way I relax is I go to bed very early, unless I have something to do. But I make sure I have adequate sleep. There are times I go to bed at 7 o'clock, but then I wake up very early. That's the time I do most of my work and to read and things like that. Okay. And now when I want to sleep, I put my phone off so that I'm not distracted or woken up by phone calls. So yes, I wouldn't mind stress management and things like that, but I try not to overstress myself. I try to take my job very easy.
Okay. Thank you, Ambassador.
Well, I wanted to mention about the health in Sierra Leone. Okay. Now, what I wanted to say was that when President Ernest Nkrumah took over the reins of government in 2007, Sierra Leone was rated the least developed country, and we had the highest maternal and infant mortality rate in the world. Now, it's pleasing to know, and we are very pleased to announce that United Nations yesterday announced that Sierra Leone has done a very good job, and we've been able to reduce infant mortality and maternal mortality by 50%.
Wow.
It's a huge example for Africa, so says the United Nations. I heard that on the BBC, to say that is a huge development that Sierra Leone has done, and they were even saying that it's a beacon to other African countries to follow. We are very proud of that. And our aim is to have zero in terms of maternal and infant mortality.
Wow.
And also to be able to provide free medical attention for
Yes.
every Sierra Leonean.
Yes.
It's the duty of government to do that.
Yeah.
But we are taking it step by step, and maybe to use this opportunity to appeal to international organizations, to appeal to other groups working in Africa, that we have to make it sustainable.
Yes.
We've been able to halve the infant and maternal mortality that we used to have,
Okay.
and we need, for it to be sustainable, we need to have a lot of assistance from wherever we can be able to get it.
Yes, definitely. Okay. Thank you. Congratulations on your success.
Thank you very much.
President Karoma is doing excellent, and you're doing excellent here. Thank you for this opportunity to be on Celebrity Health Talk, and congratulations.
Thank you very much. I think it's an awakening for me.
Okay.
I'll try to see that I do stress management and other things which you have suggested.
All right. And again, we are here at the Embassy of Sierra Leone with Ambassador Stephen Bokari. Thank you and have a good day.